Hi, everybody. Welcome to another episode of The Usual Place, the podcast where we have real conversations about the headlines. Just a content warning about today's episode. We'll be discussing data on suicide, so listener discretion is advised. Mental health has become a national conversation in Singapore, and there are many initiatives, such as a national mental health and well-being strategy in 2023. But the recently released data from the annual report on registration of births and deaths show that there were 441 suicide deaths in Singapore in 2024. One statistic stands out. Suicide among adults in their 30s rose by 50%. What's affecting millennials, and are there concerns that may currently be overlooked? I'm Natasha, and to join me in this very necessary conversation, I have Dr. Jared Ong, a psychiatrist and medical director at Connections MindHealth. And you have a lot of experience in the mental health space. So you're also a director with the Samaritans of Singapore, or SOS. And before that, you were the founding chief of the Department of Emergency and Crisis Care at the Institute of Mental Health, or IMH. And even before that, you were a military psychiatrist for the Singapore Armed Forces. Okay, welcome to The Usual Place. And next to you on the couch, I have Anthea Ong, the founder of SG Mental Health Matters, which is a civic initiative focused on advancing mental health, policy literacy, and public participation. Now, out of this came Project Hayat, and Hayat means life. And
Malay,
in Malay, and you are the co-lead for Project Hayat, and there's a white paper for a national suicide prevention strategy. And you're also a former nominated MP, and you continue, and while you were in Parliament, you championed for mental health, and today you continue to champion mental health support in Singapore across various spaces. And just to bring Jared into that, you're also a co-lead on Project Hayat as well. So both of you are very well placed to talk to us about suicide today, but I want to start with the statistic that I highlighted, which is the report by the Immigration Checkpoint Authority of Singapore logged 99 suicide cases for adults between 30 and 39 in 2024. Now, there were 66 cases for that age group in 2023. Jared, I want to start with you. Are we able to tell why there's a significant increase in that age group particularly?
I think the statistics tell us a certain picture. We know how many people died from suicide. We know the age group of those who died, but they actually don't tell us why. I think to answer that question, we do need to look at the individual cases a little bit more carefully. I think this rise in 50% is a significant number. We always talk about wanting to look at the rates, but this increase in 50%, if the population rise is not 50%, that means that there is a significant increase in the number of people in this age group who died.
And you're looking at the numbers.
Yeah, I think Jared's right. I agree with him. But I also think that we must remember that, the people we lost in 2024 in this group did not just get distressed in 2024, right? I think the numbers, the 50% increase, but also just looking at the numbers at large, is inviting us to ask, especially for this group, the millennials, to ask what was the ecosystem, or what has been the ecosystem of care that this generation has lived through, has grown up with, right? So it's not a snapshot of that time or that year, but it's to look into the ecosystem. So going more upstream to find out the reasons, the conditions that support their well-being or not. But can I also offer one thing? I think, I'm just looking back when I was in my 30s, and that's when I had my own experience, my lived experience with my depression, and also I went to a deep, dark place, and I was in my late 30s at the time, right? Of course, it was accumulated. I would say that if I remember, now I'm of course 20 years later, but if I recall, that age is where you get a bit of what I call a role congestion. Like everything you need to do is there, right?
Yeah, because you're like building a family, you're building a career, then you're starting your family.
Exactly, and then you have to caregive.
Then you become a caregiver at some point.
And you take on a lot of financial commitment, housing, right? Children's education. So I'm not saying that that's the reason. That's actually over generalizing it. But just coming from my own experience, when I literally hit that rock bottom in my 30s, was I felt this overwhelming confluence of all the different roles
So I want to ask Eric, because
Yeah.
you're the doctor on his
In the
couch.
house.
Yeah, in the house.
Doctor in the house.
Can we put this down as potential triggers, or is this a buildup of emotion or sudden decision that leads a person to decide, I want to end it today?
So I think it's not specific to age group. I thought the best description of this is actually a little quote by Ernest Hemingway. He was actually describing bankruptcy. He said that bankruptcy happens gradually, then suddenly. I think this applies to suicide as well. A lot of us go through a lot of stress, but the stress alone during the build-up doesn't push us off the edge. That's why Anthea said just now, there's this accumulation of relationship, your roles, people getting married, starting a career. But then there's a trigger. The trigger could be the failed relationship. The trigger could be losing a loved one. The trigger could be retrenchment, bankruptcy. I think these are all things that push the person. I think it's important to know that in this age group, maybe in many different countries, including Singapore, it's not just a setback. I think people may not see that I failed at something. They may think that I am a failure. Because their identity is tied into their role as a worker, a role as a husband, a role as a father.
Can I ask you to explain what's the difference between the two, as what you say, I am a failure versus this
I have failed.
I have failed. Yeah, there is a clear
So
difference there.
I've failed usually, I mean, it is you have a setback, you try to accomplish a task and you don't succeed. And you can see that task as something that you didn't do well in, and you can do something about it. But when a person thinks that they are a failure, I think it really strikes their core identity. They lose their identity as a husband, as a father, as a child. And that's when things can get really, really hopeless. They may feel that they become a burden. And that's when thoughts of ending their life may come in.
So are the spike in suicide numbers predictable based on perhaps age group, or even where society is? Does it go up when the economy or job market sours, and which groups tend to be affected more? And particularly right now where we are, should we be concerned because the economy is fluctuating? Every other day there's headlines about people being laid off and changes, but also the geopolitical situation is quite tenuous. So what do we make of the numbers? Can we see a spike?
I think we can approach this from both individual level as well as population level. I think it's pretty clear that from a population level, we can see patterns. I think there are many research that shows that, for example, after the 2008 financial crisis, there was an increase in suicide numbers. And this is worldwide. This is not just limited to Singapore. And they found that a lot of them belong to working class males that increase. So population level, we know that if there is a period of economic instability, there are a lot of job losses, a lot of household debt. We know that the pattern is that there will be an increase in suicide numbers. The problem is that at the individual level, it's really, really difficult. We can't predict suicide accurately. I'll tell you that as a psychiatrist, as a doctor, I could identify who are at high risk of suicide, but I cannot confidently tell you who among the high-risk individuals will end up taking their life. So this is something which troubles healthcare professionals, psychiatrists all around the world.
Yeah, because you won't know if someone who's walking around is thinking of, dying.
Yeah, that's right. I think even recently I read some research that they tried to use AI to predict who might be able to, whether AI can predict the model, who will kill themselves. They found that they also can't. Not accurately.
So I have questions about AI, but we'll keep that for later. But I wanted to quickly touch back on something you said because of where we are, that age group, the 30 to 39, right? So how much of the issue stems from our society? I mean, I think people would say we do live in a pressure cooker society, and there's always this fear of falling behind, or in terms of jobs, the home you own, even the car you drive, or I think many millennials feel like they perhaps don't have it as good as their parents because this is perhaps the first generation where they're like, I'm struggling so hard and I can't get the things that my parents have at the age that they were, and I still can't buy a house, they could. So what does it say about the pressure cooker society that we live in?
I think the other thing to note with this particular population group was also revealed by our recent public consultation by SG Mental Health Matters on the National Mental Health and Wellbeing Strategy, which you mentioned earlier at your introduction. And what we found from this nationally representative survey was that fewer than half of them felt the working population, the working respondents, they actually felt they could not actually seek help at work when they are struggling without negative consequences. Right, I raised this to share that, institutionally, our environments, the kind of support structures, we may now, especially with this particular group, there is a fluency with the mental health language that could allow them to come forward to maybe better express how they're feeling and what maybe they need help with even. But I don't think that's matched with a safer environment that we are in, where our lives are taking place, whether it's the workplace or school or in the family, generally. And as you mentioned, the way we define success in our society, I think we have just doubled down in just making it even more, of a pressure cooker, if you ask me.
Why do you say that?
I say that because I feel like with AI, just with just technology, but not just AI, just like in the way our society has evolved, there is even an expectation that it's not like, when we first started nationhood, we didn't have a lot of resources. Now you have a lot of resources, right? We are a meritocratic society. We all should be doing really well. Right? That whole narrative comes about when I'm talking to younger people or even millennials. My own lovely goddaughter actually also lamented, like, she's doing really well in her work. She's just hit, her early 30s, coming to mid 30s. And she's asking, why am I still not able to sort of get a flat? Why am I, So there's a sense that they are even feeling like they have to by this certain age to
We're all
establish
following
themselves.
a plan.
A certain plan
Like,
that is like written for us, a certain trajectory. And I think it's even more robust. Sorry, I just touched the mic. It's even more robust now. I don't think I have such a clear, I don't know about Jared, but during my time, it's like, okay, just go with the, whatever happens. And it was a lot more clearly marked, right? You finish your school and you go to this, and then the pressure wasn't so much to get a house. So that was not a huge thing unless you were going to get married. And I got married so late. So the whole owning my own house didn't really come about as a real concern or a mark of success.
Yeah. Jared, do you agree? Because you were nodding your head. I mean, are you seeing some of these things with your patients?
I want to add on to Anthea's point. I think mental health literacy in Singapore did go up. I think we have a reduction of stigma as well. People are more willing to talk about mental health trouble. It's not uncommon now that you scroll your TikTok or your Instagram feeds and you do see people sharing about their burnout, sharing about mental health, sharing about anxiety. So the awareness gap has reduced. I think that kudos to Singapore. We have done that quite well. The problem is the treatment gap. There is still a treatment gap. I think a lot of surveys have shown that even though we can identify our feelings, what we are going through, we may not be seeking help. And that is a problem. I think the other thing is that even though I see a lot of people, including my friends, talking about their own struggle with burnout and their own struggles with anxiety, they don't actually tell this to the people who really can do something about it, such as their managers. I can't imagine it's easy for someone going to their boss and talk about not being able to cope, talk about having to take a leave of absence because something is going on at home. And it's even more inconceivable for people to find it easy to sit down with their parents or their spouse to say that I don't feel like living anymore. So these are the disclosures that matter. I think, of course, it's great to go and talk about mental health and burnout online and things like that. But when it comes to what matters, can we really do that kind of disclosure? And of course, I must declare that this talking about mental health issue is great for reducing stigma. But imagine if everybody start to talk about how burnout and how distressed they are. I think it loses its signaling power. Imagine 10, 20 years ago, if someone comes forward and say that they're not coping at work. Yes, we take it really seriously because not many people talk about it. But now when everyone talks about it, the person may not even be able to tell, is this normal exhaustion or is this actually, I'm clinically significantly anxious. So that's that signaling thing that may be a little bit lost as well.
Are you saying that we have too much resources available, too much data, too much commentary about mental health?
Maybe not so much resources, but I think we need to balance between increasing mental health literacy and providing available resources that's both affordable, accessible, as well as confidential. We need to provide those resources.
Yeah. I perhaps I misspoke. Should I say resources? I mean, like in terms of like information out there on the internet, on social media, you always have people who are talking about about how my mental health is today.
Yes.
You should seek help. Or there are even, people, doctors on TikTok who tell you how to identify your symptoms, right? Yeah,
but I don't think we should keep the conversation only at the individual level, though. Right, I think to Jared's point, it's one thing when you have that mental health language and awareness and literacy, right? But if you know that the environment you're in, whether it's at the workplace or in school, for the younger folks, or even in the family, as Jared said about parents, right? Then even if the individual is willing to seek help or needs help or understand that he or she is not in a good place, then but you're not feeling safe with the environment that you're in, right? So I think we talked about, yes, the anti-stigma has definitely worked, right? We are normalizing mental health conversations and helped a lot by COVID because, that whole COVID period really allowed mental health to surface. And then to Jared's point, but we still have a treatment gap issue. In between is actually the environments that we are all in that allows us to have that sense of felt safety, right? And I want to emphasize the word felt. Cannot just say,
you can't just say it's a safe space, but then...
No, just say it's okay. As a manager, I will understand. But if they know and they looked around, or the workplace or the school doesn't really instill that sense of safety, and they have not seen examples, but they've seen the negative example of someone coming forward and there is a negative consequence of, a career risk or even worse, a career, demotion, then that becomes a standard, it becomes a culture, right?
So what other safety nets do we need? And I want to go back to that millennial age group, which we started talking about, because young people in school will have counselors. Even in NS, there are doctors that they can turn to or counselors that they can turn to, right? And then older people have, someone to look out for them, like caregivers or people in the community who look out to them. But then there's that gap in the middle where, as you said, and they were in the workplace and maybe people are not looking out for each other because they are concerned about work, right? They focus on that. So then as a sandwich group where you're thinking about how do I pay the bills, when is my next paycheck coming in, how do I get a house kind of thing. So more responsibilities for this age group. How come they are not getting, more targeted help perhaps, or resources?
I will need to, I need to give a shout out. The National Mental Health and Wellbeing Strategy has 4 pillars. And one of the pillars is specifically workplace, right? So that is a very intentional effort to focus on this very captive audience that we have. And in fact, the workplace is a very organized structure if you think about it. 70% of our adult population is working, right? We spend more than some of us, a major part of our working hours working. That's actually a great place and great environment or a support structure to be had. And so in the last years, especially since COVID, because it also has a direct impact on productivity and performance, there's a lot of effort. But the thing to go back to is there are counselors, what we call Employee Assistance Program, EAP, right? So especially the larger employers are providing that counseling service to workers as well. But increasingly, we're also seeing that's not enough. You need to change the culture. Just providing that service. In fact, the counseling service at most workplaces are very, very underutilized. Someone told me once that it is actually less than 5% usage, right? Because of this stigma that it is going to negatively affect your career progression.
Yeah, because I can imagine if they offer you to see a therapist, but it's of the company's choosing, then you will always have, okay, this personally speaking, back in mind, you're like, legit, will they tell my employer okay, I had a mental breakdown today. I had a panic attack or whatever in the office. Like, will they tell? I think that's at the back of their mind.
Exactly,
Or even if they have like mental health champions in the office who are your colleagues. Like, do you
Yeah.
want to be talking to a colleague about this? I don't know. Like, Jared, what do you think about, the safety gaps in the workplace for mental health?
So as what has been discussed earlier, I do think that at the workplace, even though it's a captive audience, but they are so disparate, right? The different kind of workplace, different employers, even the EAP programs, what is provided, is also not the same quality.
True.
The issue is with trust in the system. If there's no psychological safety at the workplace, it's very hard to trust the provider provided by the employers. Do they get data back from this particular EAPs? I think they do, because you need to know utilization rate.
They do.
It's anonymous, right? You don't know the exact issue, but they do need to know that how many people are using those services. And like what Anthea said, it's usually about 3 to 8%. It's not a very, very high take-up rate. I think the issue is that there's always this perception that if I see a EAP, if I talk about work problem, will my promotion chances be affected? Will my boss give me a lower performance grading this year if I go? These are very, very real concerns,
Very real.
even if they have a good EAP on board. Imagine if some employers, they arrange for a counselor or psychologist to come to your office on certain days of the week at a particular room. So every time you walk in the room, you'll be wondering.
People know.
Yeah, people know.
But it's the same in school though, Natasha and Jared, right?
Yeah.
I mean, a lot of because I chair a secondary school, the counselor, going to the counselor is still seen as a bit of a punishment, because it's about sort of, working out your problem behaviors, right? Which is why in our school, we started talking about having a calm room. So really reframing what it means to, have a space for a student. So it's the same thing in the workplace, actually, that it is not just about talking about providing all of these services. In fact, one group that I'm involved with called Work Well Leaders, which we focus very much on the CEOs and the leaders in looking at workplace well-being, right? Not just as an HR function, certainly not just sort of having the services and tick off the boxes, but really changing, to Jared's point, how do you change the culture of the organization so that there is trust, there's psychological safety, and the sense of belonging, that then when you say, hey, go for the EAP, it is anonymous, to Jared's point, they trust you. Otherwise, if you don't have a trust culture to start with, you say, hey, don't worry lah, you go to EAP, really we don't know. They don't want to take the risk if they don't have that, sense of trust with you, right? Yeah. So working on the leaders is very important, which is the work that we're trying to do at Work Well Leaders. And the group that Gerald's involved with is also part of this collective effort. So I think we need to look into really just different levels of change within the ecosystem. I cannot emphasize enough that it cannot just be on the individual. Yes, we must provide resources, but if we keep having this, narrative that it is on you, if you're not actually feeling well, then it's because you don't want to come and seek help. I think we must also understand that psychologically, there's a lot of things preventing an individual from seeking. And I'm speaking from my own experience.
I'm also with you.
Yeah, I was dripping in shame when I actually finally took the step to go and see a psychiatrist 20 years ago. I was
and there was a
drowning
time
in
when
shame.
we didn't even talk about mental
and I was
health.
a CEO. I'm like, I'm not even supposed to feel like that. I have, to Jared's point, I actually say I'm a failure. I did not say I failed in this relationship, right? Because my marriage was broken and all that. I actually say I'm a failure, that I'm actually here waiting to see a psychiatrist. And that stigma is not social stigma, it's self-stigma. So what we've been doing very well is anti-stigma, and we've done a great job, especially with the Beyond the Label campaign, the national campaign. But the self-stigma is what Jared talked about, is how do we identify with the challenge that is that we are feeling? Do we identify as a challenge that we can overcome, and therefore I have failed in this? So in my case, I failed in my marriage, instead of saying I am a failure, which means it's my whole life lah, my whole identity.
So I'm glad you brought up that point about stigma, because it actually is a good segue to talk about a particular group of people that might face the stigma more than women, which is men. So in 2024, across all age groups, men
Mm-hmm.
actually accounted for nearly 2/3 of the 441 suicide deaths that were recorded that year, right? And the provisional data for 2025 shows a similar proportion. So,
Yep.
Gerald, why is there this disparity between genders? Does it have to do with stigma of men getting help?
I think there's many reasons. In fact, they call this the gender paradox, that in terms of completed suicide, death by suicide, usually 2/3 are men. I think there's actually this really good example. China, many years ago, there were actually more females who killed themselves compared to men. And they realized that it's because of access to lethal means. So women living in rural China had more access to lethal means of suicide, pesticide ingestion. And they found that actually more women were dying from suicide than men. And then with regulations restricting the lethality of pesticide, with urbanization, the pattern in China reversed. So now their pattern is more similar to the rest of the world, where 2/3 are men and 1/3 are female. So methods matters a lot.
Yes.
So when
The
we look
means.
at the means of suicide, men tend to choose more lethal methods. And when they choose those, they're more likely to die from that. Of course,
Is there a reason why they choose a more lethal way?
that's a very... I can give a lecture about that, but I won't. I think it has to do with I'll do it very briefly. I think based on the prevailing theories about suicide, one of the things that people must overcome is their self-preservation, their fear of death. And you overcome that by habituation. So men, by their nature, by their impulsivity, risk-taking behavior, they are more likely to have a thinner barrier to choosing something lethal. So this is biologically, that is one of the possible explanation.
We had this conversation before we came on,
Yeah.
right? And I was actually quite surprised when you said men are more impulsive. I was like, what? I thought they would think through it. I mean, that was my perception, but clearly, Jared, you have
the
dispelled
male
it.
brain more impulsive. Plus, I think men are also more likely to use alcohol, to use drugs, and
Substance, right?
increases impulsivity as well. So those are both directly and indirectly contributing to men being more impulsive.
Why do you think they find it hard to express vulnerability or seek help before reaching that crisis point?
I guess part of it has to do with biology. I think there are many studies that show that the part of the brain that connects emotions to language is actually underdeveloped in men. Women have a better, I have to say this, it's better developed the pathways.
It's okay that you are saying it as a man.
Yeah, that's right.
That's why I'm directing all the questions about the men to him.
Yeah, so they are less likely to be able to name what they are going through, but it doesn't mean that they don't feel it. I think men do feel the distress, but what comes out will be anger, will be going to alcohol, will be irritability. And it is less common for men to go and seek help for anger problem. People are just going to attribute it to it's your character, it's your personality, but that could actually be a manifestation of their distress that they are having. They are undergoing depression or anxiety, or just having difficulties coping with the rigors of life.
So what can we do for men? Because to actually get them to consider seeking help before they go down this path, right? I mean, can men groups, I think there was a recently launched like Men Too movement. It's stuff like this that's popping out now, but is it going to change the way we think? Or are we just very deeply entrenched in the way we think about men in society?
I think we need to turn it around, right? If we have enough knowledge, and Jared has shared so much of it, and like he said, he could give a whole lecture, then the way we actually look at designing the support systems or solutions for them must be done in a way that is speaking to what's most natural and comfortable for them, right? I was just having a chat yesterday over tea with someone who's working very much with the aging population. And I bring that up in terms of the way we design, some of our social support structures. The active aging centers are often frequented almost entirely by women, right? And therefore, if we really want to support, our senior men, then we must think of another way of supporting them if we're trying to get them. So I think similarly with, supporting men in terms of, getting them to be feeling like they are supported before they get to hit, a point of crisis and be too late, right, in supporting them. I think we need to look at what they need to be most comfortable instead of looking at a one size fits all. And that, hey, the thing is there, you come lah, without actually having that sensitivity, whether it's gender lens, age lens, sexuality lens. I think that's really important. And that brings me to a point that we need to increasingly, I think, as society is evolving, that many of the complex challenges that we're dealing with, suicidality, mental health is definitely a very complex problem or issue. We must look at it as a life course approach instead of trying to be looking at, this group, we must do this for them, then this group, we must do this for them. When actually they are moving anyway, and each group are surrounded by also people from the other groups. Right, so you really cannot be, which is why in sociology we call it a collective actions problem. So we really have to look into both the individual, how do we support them through their life journey, understanding the risk factors in every stage of their life, right? But also at every stage of their life, who are the enablers around them, right? And I think if we don't have that kind of conversation, we keep going back to the individual level responsibility, which I think can be very overwhelming. And as Gerald already alluded to, he, even as an expert, cannot predict suicidality or suicide in a person, even if, the data can help us see some patterns, right?
Yeah, so far, you see a lot of the campaigns that we have about suicide prevention is it's okay not to be okay. Let's talk about our problems. But this applies to people who are already okay to talk about their issues. As I mentioned earlier, sometimes men would have difficulty expressing themselves, and to ask them to share their deepest, darkest thoughts or something that makes them feel shameful with another is akin to asking them to be a different person. So they find it really, really difficult to open up. Even though all the campaigns tell them to. And I think the other thing is that a lot of times, I do think that men they do better when you have side-by-side conversation, not face-to-face.
Yes.
As in like physically side-by-side?
Like the
Physically
walking
side-by-side,
and the running is very good.
So I don't know about you, but I love football. So I recently saw a mental health campaign by Norwich City Football Club. And they talk about suicide. They talk about mental health while watching a football game. And that is identifiable. They engage their soccer players to come and lead the discussion about mental health and about suicide, which I think makes it more powerful than a generic campaign asking men to talk about their trouble. So we see men sitting beside each other, they talk about their issues, and they're watching the game. I think that's more powerful.
So true, Jared. I recently have a friend who shared with me that he feels so tired having to keep repeating. When he went to see a psychiatrist and a psychologist, and with the psychologist, he's sharing with me he said so tiring to keep talking, about what's going on, why am I feeling this way, and all that. And he's decided that he's not going anymore. And the running is more helpful with him, like just a buddy running with him. Then, so that's so true. I just want to add a real example that I just heard recently from a friend.
I mean, so this has to be targeted. We have to look at maybe the 30 to 39-year-old men. Where do they frequent? Is it a coffee shop? Is it a football stadium? Is it, I don't know, a coffee shop, right? Then we have targeted, that's right, targeted campaigns, targeted messaging there about seeking help. So I think that will have more value than something that's generic.
So I want to segue back to something that thing that I was asking you about, which is AI. And basically we're seeing people globally, everyone's using AI, right? But we also see people using AI chatbots to get mental health advice. And in some cases, the chatbots have actually led people to suicide. They have told them that this is what they should do. This is the advice that they've given, right?
Lawsuits going on.
And there are lawsuits, especially in the US. I mean, I don't think I haven't heard anything in Singapore per se, but is this something we should be concerned about? Jared, from your point of view, when patients come, do they say, oh, actually, I already keyed this into like ChatGPT, then they told me.
Yeah, so I think it's a double-edged sword, as with most things in life. I think why people use AI is that it is convenient, it is accessible. At 3 a.m., you can't talk to anyone, your friends are all sleeping, you could chat with your AI chatbot, and it is relatively cheap. Even if you pay a subscription, you're already using your AI for many things. And If you have trouble, you could talk. And for many men, as I mentioned earlier, that first step is always the hardest. And it is very easy to talk to someone that doesn't judge them, that in fact will agree with them.
Very affirming.
Yeah. I have got patients come and see me in a clinic because AI told them to do so, that they need to talk to somebody. So I think there's some benefit there.
Yeah, that's great, right? Like at
That's
least actually, I'm kind of surprised that they trusted the AI versus themselves. Like, why did
Yeah.
they need the AI to tell them to see you?
Well, AI could represent their first port of call the first time they seek help. And I suppose when they enter their symptoms and the right prompts, I think AI told this particular patient that he is likely to be suffer from depression and listed out the treatment, one of which is to see a doctor about the problems. And that's how the patient ended up with me. So I think this is where AI chats will do well. They are really good on providing psychoeducation, good information, linkages on where to get help. I think AI is really good at that. I have some patients who use AI, especially now with the dictation tools, as mood journaling, as mood tracking. And I think that has helped them. They print it out and they show it to me that this is how their mood has been for the last 1 month since the last appointment. And I found this really, really helpful in therapy. I think what AI doesn't do so well is that it is too agreeable. Even if you enter prompts for it to disagree with you and challenge you, I think AI doesn't do such a good job.
Love bomb.
Yeah. And the issue is that sometimes in therapy, in life, you need to be challenged. And imagine if someone in distress, having distorted thinking, whether due to depression or anxiety or even a more serious mental health condition like psychosis, and you have AI that validates you and agree with you, I think it can further amplify that distortion, and it's very dangerous. I think what AI also cannot do is that it cannot call for help, not yet. AI can't call your mom or your dad's or your spouse's phone and say, hey, this person entered this chat. I think you need to check in on him. AI can't do that. And I think the other thing about AI, I have some, these are not patients, these are actually friends. They entered something into AI and AI gave them a proposed solution. They feel that I already seek help. So they are not keen to seek further help beyond their AI chatbots.
They're thinking I've already sorted it out.
Yes. And I think that is a net loss because that's not connection. That is just getting knowledge. It doesn't translate into action. So this is the problem.
I mean, how does this now change the campaigns and the messaging and the, telling people, because there's now this added factor of having AI in the conversation, right? So, and in terms of the groups, especially the ones that you lead per se, like how does this change the response?
So now we're actually making sure that we keep saying as AI becomes more human, we mustn't become less human, right? Which is, we have to double down on a big part of mental health and suicide prevention. As much as the national level effort is very important, so we continue to push and champion for the national suicide prevention strategy to be something that can then help the entire ecosystem coordinate, workplaces, healthcare, schools, communities, families, right? But at the same time, it's also an everybody responsibility. My concern is that if we start to make AI too much of a foreground, strategy, right, in mental health or suicide prevention, then we're actually becoming less human than AI. So we have to double down, right? All of us need to just make sure that we notice, we listen, we check in on, everyone around us and let them know that they matter. One individual came up to me when I was doing a sharing, and she's a very senior person in a bank. And she said that one thing, and she broke down actually because someone asked a question like, "Can you just share why people want to end their life?" And my response to that was, nobody wants to end their life, but everybody wants to end our pain, right? And this other colleague of this person who asked the question broke down because she said that was the first time she finally understood why her son, had made suicide attempts. Right. So we also must know that, as we see these numbers of suicide, completed suicides, which we are talking about, we started this conversation with, we must also understand that there are also, suicide attempts that are in our midst. Right. And then there's suicide ideation, which I myself did not know there was such a term when I went to a deep dark place, right, more than 20 years ago. So there is that literacy aspect of it. But, Jared and I, when at Project Hayat, we were very clear in emphasizing that not everyone who has a mental health condition lives with suicidality. And not every completed suicide has mental health as an underlying reason, right? So then that means that we can't just put suicide and mental health as equivalent lah, right? And those kind of nuances is also important. So that's why we are really, as I think the different groups that we are involved with, is now going the next step of not just giving knowledge, which now AI clearly can do, but to then, bring in the human level, but also the encouragement, the nuances, the keep pushing the, hey, are we, walking the talk in building a trusted community? Are we ensuring that we are bringing, what we can to create a sense of belonging?
So, I was going to end off with this because often in these podcasts, I always say, what can the government do? But I also feel like this is personal, and I feel like it's not a thing that the government should step in and help us. I think it's we need to do it when we.
Oh, they can help us also lah.
But on the daily,
the
daily, like if I see my colleague or my friend or a family member who seems like they're in distress or but also they're maybe struggling invisibly, right? Then, Jared, what do we do in that sense?
I think all of us set out we want to help somebody. So I think previously we also spoke about all these helplines. I must tell you that helplines, not all the callers are in distress themselves. Many of them are actually calling on behalf of their loved ones, on their friends. And actually, if you're not sure what to do, you can call the helplines, the Mindline, the SOS hotline as well, to ask them, actually, you have got this person going through this trouble. What can I do? And they will give you advice. I don't think we can expect everybody in Singapore to be trained to be able to do suicide risk assessment, counseling, but we can certainly take very practical steps, and this can be communicated to you when you call these helplines as well. It's not just meant for people in crisis, it's meant for people caring for those who might be in crisis as well. Okay. Yeah, so that's one thing that we can do.
All right. So I think both of you have given us a lot to think about. Anthea, you have succinctly noted that people in their 30s and 40s have like a role congestion. Basically, a lot of things seem to happen at the same time. But then also in the workplace, do we have safe workplaces and where people can actually like seek help without actually impacting their careers? I think that's always at the back of people's mind when they want to seek help. And also, Jared, you pointed out that we have closed the awareness gap, but then there is a treatment gap that we now have to look out for. And I really like that you pointed out how we can help men, which is, if there's anything that we can do is actually walk, run, play side by side with them versus like having full-on like face-to-face conversations, and then we'll hopefully get them to open up and we can help more people. So thank you very much for sharing your insight today. And that's it for this week. Now, if you have a take on today's episode, drop me a note in the comment section on YouTube, Spotify, or Instagram and tell me what you think. Now, if you need to speak with someone, as Jared says, or seek help, we have linked helplines below. I will see you next Thursday.